Okay, Carol Johnson, how are you today?
Hey Bob, I'm doing good. How are you?
I'm great. I'm great. It's Thanksgiving week rather, and I'm thankful that we're still here. Thankful for all the people who have made it through a very challenging year, and it's still challenging. But this week we're thinking about our thankful and our blessings. Correct?
Absolutely, absolutely. I'm happy to be doing this special broadcast tonight.
Right.
We still have a lot of things to talk about, and we have to just keep going over and over again so people get the message.
Right. So we're blessed to have a great guest today. Would you like to introduce her?
Well, I certainly will. This is my partner. We are both co-founders of the East Harlem East Harlem COAD community organizations active in disasters. Uh, she is the project director for the COAD. She is also a founding member of the East Harlem Emergency Preparation Collaborative. My buddy, my colleague, my sister, and I want to introduce Dr. Angel Palermo.
Hey,
Angel, welcome.
Thank you so much.
This special introduction.
Yeah. Thank you, Carol.
So we're so glad to have you on. First of all, I want to acknowledge East Harlem COAD as being one of the premier emergency preparedness groups in the city. Definitely in Harlem and Upper Manhattan, but really, you guys have really taken a real aggressive tactic to help make sure that your community is prepared for emergencies. And we saw how useful and necessary it would be this year with this COVID-19 pandemic that's hit us so hard. And I think today we want to talk about the issues that we are still talking about, because we've been talking about these issues persistently since February and March, really. And unfortunately, as much as people feel like New York City has done good or better than the rest of the country, we still see the gaps in resources and the holes in how things are allocated. So let's talk about a few of those things, Angel, that you see are things that we're still immediately facing as we go into the holiday season.
Sure. First, thank you for the opportunity to join you both on this important communication pathway here to local listeners and local residents. And I just want to say, the East Harlem COAD was established in 2015, and the strategy behind the COAD was to really push for hyperlocal planning. That we felt that the best way to protect communities and keep communities ready and prepared, like neighborhoods like East Harlem, who are already geospatially vulnerable, pre-existing vulnerabilities for many reasons, including systemic racism. Our strategy was drill down and let's engage partners that are not seen as traditional partners in emergency preparedness, and develop ways to do hyperlocal planning and execution. We said that 5 years ago. And what the problem that persists today is exactly that we don't have the data to do hyperlocal planning. And that's why there's no access to why East Harlem became hardest hit. And the tragic benefit of this pandemic is that East Harlem COAD in particular has been seen, now is visible. And what we've been saying 5 years ago about really supporting and allowing and equipping community-based partners and organizations to participate in the planning and the response at the local level, there was resistance 5 years ago by all of the emergency management official organizations and the Department of Health. They just couldn't wrap their mind around really allow that to happen at the local level. And so over time, as we built, I think, a certain amount of street cred, if you will, and had powerful individuals like this Carol Johnson just really make the point, among others who contributed to the COAD, that we know what we're doing. We know how to deeply penetrate our networks. We know how to spread information, the correct information, and we know how to create bidirectional relationships and feedback loops. And so what wasn't leveraged, I think, optimally was tapping into that so that we could actually maximize our ability to be prepared and ready. And we weren't for this pandemic. Ironically, just as the pandemic hit, we were setting ourselves up for a community-wide tabletop exercise. And the exercise was going to be a pandemic plus a blackout. And we were really queued up to do that. Remember that, Carol? We had spent several planning meetings with the Department of Health and NICEM on that. And they got it. They're like, hyperlocal planning, we finally got the agency resources behind it to test this out in East Harlem. And the pandemic hit. And so we had to make a pivot. And that pivot was becoming an informational resource that was to curate the information that was coming all over the place, which is a lesson learned observation, which we could talk about. That we curate it so that it was useful and relevant and timely for East Harlem. And we tapped into our social media, we tapped into our networks, we tapped into all the ways that we could in the moment to get the information out. We even created our own guidance about how to stay safe when sharing space, right? Like we were responding to ourselves, which is what, inherently what the COAD is intended to be. But it wasn't contextualized in a plan. It wasn't contextualized in an approach, in a strategy to keep neighborhoods like East Harlem safe that would have been co-designed with the city. And that is the failure of the city in East Harlem. So the failure is really about, not tapping into these pre-existing, robust It wasn't contextualized in an approach, in a strategy to keep neighborhoods like East Harlem safe that would have been co-designed with the city. And that is the failure of the city in East Harlem. So the failure is really about, not tapping into these pre-existing, robust, rich nodes that have been developed and missing the opportunity for hyperlocal response. And so when we talk about what's happening now, is that we're in this space of like, how much harder are we going to get hit? Because we've got flu, we've got COVID surge happening. We've got signals of the surge happening that aren't being explicitly talked about. And the data isn't drilled down enough, And so we've been thinking about other ways in which we want to see information so that we can do some systems thinking and planning at the local level. And I'm sure prior to me coming on and joining you in this broadcast, you both have been having these dialogues about what's missing in the data, it's delayed. As Ms. Johnson would say, send me to a website. It's always to these websites, and it's not like in the hands so that we can literally act on it and execute in changes of practices and behaviors, right, at the organizational level. So I think that we need to speak to the failure of the city in protecting neighborhoods like East Harlem, who are already vulnerable pre-pandemic. And so that's the conversation that's missing. I think we're also missing an approach that applies an equity framework to emergency preparedness. And that now, because we saw the disproportionate impact on Black and Brown populations and communities, now everybody wants to backpedal and have an equity approach when that was missing from day one. And so why does equity all of a sudden become an afterthought when a crisis hits? And that is a problem. And so, how do you inject equity when it's rooted in inequity, right? You want to fix it with equity, that doesn't necessarily feel right. And so I think we need to really acknowledge what didn't work, uproot the inequitable practices, and then transform and redesign. Like certain things have to be dismantled. The way information gets out, the way in which resources are organized and coordinated, it's a mess. It's like we can't keep track of like where masks are coming from, where sanitizers coming from, where testing is happening, the turnaround test time results. It's all over the place. And so the COAD is spending its time trying to keep track of all that on behalf of our partners and of course East Harlem. And yet, you know, we can't unfortunately do it all. But it is wasting time. Like, it's literally wasting time, and people are dying. I saw a statistic that every minute 48 people die from COVID. Every minute.
It's crazy.
It is crazy. It is crazy. And we're wasting the time. I'm wasting a minute trying to like look for a testing site. Like, come on.
Mm-hmm.
Right? I've been directed to 10 websites. Like, it's unacceptable.
Yeah.
You know, I think that because the federal response was so bad, it makes our response look better, you know, because the bar was so low that by comparison, it made New York City and New York State look like they were shining examples of what to do. But clearly they're not. And I actually see some parallels. Like, I don't see the total lack of empathy and caring that the federal government had. But what I've seen is that the lack of coordination between agencies. You know, we've always had to deal with the city versus state, and then within the city, we have things split up between the Department of Health and Hospitals Corporation, and a lack of coordination between them and NICEM, and we just see things not getting done, and we don't have the luxury of things not being done. You know, that's what happened. Why we got hit so hard in March and April, with a lack of coordination, and we still have yet to see proper testing and contact tracing in our neighborhoods. And that's the heart and soul of stopping a pandemic, is that coordination and that activity. And we just don't see it being done at the level that it needs to be done at.
Yeah, and you know, one of the reasons we were hit so hard is that there were plenty of resources. Unfortunately, the resources always go to the people that need them the least. You know, those who, you know, I'm not even saying that because, you know, you may be money that you should spend all of your money to take care of yourself. I think that, you know, when you're a resident of the city, if you need help, you should be able to apply for help. But the people that needed the most were the ones that was not only left out, but talked about and being left out. You know, we need to reach out to this demographic, but yet you don't reach out to us. We need to get you resources, but yet the resources never come. We're getting more testing sites, but you never see them. You know, we're going to look at NYCHA housing because they're the backbone of the city, and East Harlem having the largest accumulation of housing developments in New York City. And yet when you take the testing sites to NYCHA, none come to East Harlem. I mean, you know, this was totally unacceptable. And when you look at the sites and the fear of people traveling around, first of all, going out, the people who needed to be home taking care of themselves, the most vulnerable ones were the ones that was going out, forced to go out and help other people. You know, when you look at the transportation, there's been so little spoken of how the trains and buses are being sanitized. People are still fearful of taking Access-a-Ride. They're still fearful of taking, you know, a bus or a train. And the testing sites are so spread out. When you look at Metropolitan was the one place, Metropolitan Hospital was the one place that had a testing site in the beginning. They're at the end of Harlem. They're at the borderline of Yorkville. So what about the people that live all the way up 126th Street? The people live 130th Street on the east side. Harlem is a very large area. 96th Street, FDR Drive to east of 5th Avenue, all the way up to 143rd Street. To the east of 5th Avenue. It's a huge area. And just looking, you know, trying to find a site, I had to go all the way over to 126th Street and Broadway, you know, in my scooter because I did not want to get on any buses. And when I went, they couldn't even tell me what tests they were giving me. The city was doing one, the state was doing the other. When you called, they couldn't give you information. As a matter of fact, I called one place and they gave me an email address. And I sent the email, never heard from them. You know, so these were the constant inconsistencies that was taking place in our communities. And I think what makes me the angriest is that, you know, the elected officials, they kind of sit back like we shouldn't complain. You know, that's the worst part, when people say you shouldn't complain. We were out there. We were the boots on the ground, out there finding, scrapping, scraping, getting tens of thousands of masks, finding sanitizer, having to call people to come pick things up, pay people to move our equipment. You know, all of these things that we should have had the help to do, because that's why we were created. We have a coordinated response. We are trained well by the city, and yet you don't utilize us. That's the worst part of it. People next door will not know if we don't tell them. And the information is still so sketchy, and it's, you know, and that's why we keep coming to these broadcasts and doing this.
Also, the inequities in terms of testing and free not actually always being free.
Yeah. Right.
Yeah.
Absolutely. I mean, I was just reading an article yesterday, as a matter of fact, where they were saying that, you know, it's all free, and some people were getting bills like $1,000.
Right.
We were talking about $300, and then I heard it's $1,000. You know, so
yeah, I'm just starting. I have a colleague who's starting to investigate that more nationally. The variance in costs, you know, that are being put out there for COVID testing. You know, it ranges from free to insurance based to everything you've just said in terms of, you know, almost like a private pay fee. And so, you know, I think that it's just disgusting, really, how in particular the city and has politicized health. You know, and it is just so disgusting to see the ways in which that they've turned this pandemic into a political football of who's going to own what and do what. And it creates this chaos. It creates chaos in information, in just really in information and access. And so it's almost like a campaign of confusion, right? Which is a reference to, you know, sort of what's happening with racism and the anti-racism movements. But it is similar to this campaign of confusion strategy, right? And it's just like, well, then how do you get out of confusion? Like, how do you get out of that? And, you know, I think that's the conversation we're not having right now is like there's some entity, someone, whether it's someone's political future or some organizational agenda, is benefiting from the confusion. There's an incentive in this confusion. And we in the COAD have our eyes wide open, like this feels intentional.
Yeah. And sad is when you're on the outside and you look in and you look at New York response, you say, wow, New York did an excellent job. But when you're on the inside looking out, we're like, what are you reading? Where are you getting your information from? Because we know what's really happening or what's failing to happen, you know, and the constant lack of concern and reaching out. We've reached out to people. And we've gotten no response. And it's not like they don't know just how vulnerable we are. You know, so, you know, it's like everybody's sitting with their own little boards, but at what time are they actually going to get together in one room and say, we're going to do this, we'll be in charge of this, you'll be in charge of this? We had, 5 different commissioners that moved. The food commissioner was moved, left, and you know, the Department of Health and all these different commissioners. Every time you turn around, somebody else was coming on board in order to take over, and they weren't picking up where the last one left off. They had to start all over again. You know,
Yeah.
so when you look at things, simple things, and these really should be looked at as simple things. When you look at food insecurity, I mean, people got to eat. We're in a
First of all,
pandemic.
look, I actually don't like that term because we're really talking about hunger. Food insecurity is a nice way to say we're dealing with hunger issues, and we're dealing with them here in the city, and we're dealing with them all across this country right now. And these are the types of things we really need to hear more accountability from our elected officials, from our agency heads, as far as how they're coordinating with communities and what they're actually planning to do. And I think you brought up a great point about the shuffling of all the commissioners in the middle of a pandemic. Why are you moving people? What? Because I still never heard reasons why these people were moved around, or why these people, satisfactory reasons why you would get a new Department of Health commissioner in the middle of a pandemic. Why would you take certain responsibilities that were in that agency and move them to another agency that was already beleaguered dealing with the pandemic? So these are issues that we really need answers. We need answers from everybody, from the middle to the top, as far as what's going on, and what are we doing now as we're going into a very dangerous time, because we're still dealing with hunger issues. We're still dealing with what do they call it? The benefits cliff is the latest buzzword I heard, which is everybody's unemployment's running out, and eviction protection is running out, and so people are going into a holiday season with the most uncertainty they've seen in a long time, not knowing what we're going into 2021, when we're still talking about second wave, and we're still dealing with the economic effects, and we're not seeing a plan. We're not seeing real boots on the ground, shoulders, sleeves rolled up activity to deal with it.
Yeah, 100%. And even I think that as I said, there's a reason for that.
Mm-hmm.
And I think when we want to unpack why that is so, we're getting underneath, I think, some political agendas. I think it's all about looking good inside of, responding. And I think particularly with public health and the way in which public health, behaves as a practice, is that medicine is the practice of reaction, right? And theoretically, public health should be the practice of proaction. And in my mind, public health is failing in that. They really went to this sort of reactive, and sometimes it's good to react. Sometimes you need to react and put out the fire, but that's the only predominant response. So, when you do that, you only are directed to, which is considered to be much more of a priority than anything else. And it leads to this sort of either or thinking, like, we're only going to do this and not, pay attention to what is coming down the pike. And I think that short-sightedness, and quite frankly, short-sightedness of the practice of public health, is literally what contributed to, 250,000 deaths. And more importantly, the lives of East Harlem residents that were lost. And it's a bureaucracy. So public health is trying to, practice public health inside of a bureaucracy is also clearly dangerous, because it doesn't work well. And if anything, this pandemic revealed the system onto itself.
Yeah. And it created so many other, the failures opened up the door to see the other failures we never would have seen.
That's right.
The one thing that stands out is that now, coalition after coalition, group, organization, partnership has come out of this. There's got to be like 100 of them, and they're all doing the same thing and actually succeeding at nothing. So now all of a sudden everybody's in flu. They're talking about the flu season. You know, that seems to be more prevalent than the pandemic itself. And now it seems like everybody's getting into mental health. And of course, there's going to be more mental health issues when you are insecure, when you don't know where to go, when people don't reach out. You reach out and you're not getting help. People had issues before the pandemic. You know, with this administration, we had major issues. But now, when you don't know where you're going to get your next meal from, you know, there's still places where people can't get clothes. Now it seems like Thanksgiving, people are issuing clothes, but that always happens at Thanksgiving every year. But, you know, you have people who haven't worked, don't have any money coming in. Their children did not stop growing because of the pandemic. They need shoes. They need clothing. You know, they need things. They need household items. And there seemed to be no place to go. And you send people to certain organizations and they have a limited supply of things. Yep. You know, there's a lot of places that wanted to offer clothing and they said, no, it's dangerous. You can't give out things. But what happens? I mean, really, 8 months?
Right.
The growth of a child, they're still wearing shoes that they wore since last year. You know, I mean, little things like that are major issues, but to them it's no big deal. You know, parents are suffering. It's got to be difficult to want to take care of your child, and there is absolutely nothing that you can do about it. You know, it's got to be frustrating. So it's going to create mental problems. Seniors, you got people taking care of their senior relatives, their parents. You know, they have to work now because they have no choice. They're leaving these people at home. You're afraid of home care workers. You know, the feel-good moment with the thermometers does not prove someone does not have COVID. People are afraid to let people in. They've got to get a better system of finding out how this thing works. They taught us about mitigation. How is it that you taught us, but you don't mitigate? And you can't figure out what to do. We're here now. Mm-hmm. And 8 months later, you still can't figure out what to do and how we're going to battle this thing. And I get upset every time I hear someone say we're going into a second wave. We're still in the first wave as far as the response is concerned. Nothing's turned around. If you didn't have organizations like ours, imagine where we would have been.
Yep.
Yeah, I find it so interesting. You know, we as community organizations have all these contacts with these different agencies, but there's no coherent plan or strategy amongst them that we can discern, because you see the debacle that happened with the Department of Education and the schools, you know, stumbling into opening and then having to stumble into closing again. And the chaos that puts in the lives of children and their parents is crazy. And in all that time, you have kids who are still have not gotten the technology needed to have regular classes. So we have a generation of kids who are, you know, they're 6 to 9 months behind in their education, and there's no relief in sight, because it's
Bob, they were years behind before this happened.
Right.
Mm-hmm.
I mean, you know, and now you give them a tablet, but they have no broadband.
Right.
Mm-hmm.
That's the, you know, let's not be gaslit here, right? The point is that, and this is what we said, this is why the whole COAD started, because it's already a pre-existing vulnerable neighborhood. That all of this that's hitting us hard is because we were already hit hard with all the other issues: poor quality housing, poor quality education, systemic racism that literally organized every sector of living by race. And therefore, if you were not born into the racial category of advantage, you were systematically disadvantaged. And that is the story of Black and Brown communities all across this country. And history shows that Black and Brown geospatially vulnerable communities were the first to get hit by natural disasters in particular, and the last to reconstruct. So it's no accident as why this is going the way it's going. It's this, the system is designed this way. We just now got to see it because the pandemic is revealing it. And we are, we're looking at it and commenting and tracking in our own way and responding in our small ways that we can do that in a neighborhood level. But there is no systematic redesign in the horizon.
Yeah, we're not even part of it. We're not even on the table. We kind of get what trickles down to us, and we should be happy with that. But for some reason they think that we're used to receiving crumbs. No. Most of us want the pie. Why should we take the crumbs when there's a pie available? And that's all we're asking for. Because you would send the pie to another neighborhood, you wouldn't think that you wouldn't even consider them taking any less than that pie.
Mm-hmm.
So why should you send us crumbs left in the pan?
Right. They get pie and a glass of milk.
Yeah, absolutely. We were planning the tabletop at the same time, before this whole thing started, because we saw it. And that's what you call mitigation. Right. Trying to strike before the pan gets hot.
Yep.
And it's really frustrating, but I'm very grateful that we got together tonight. Thank you so much, Angel, for coming on.
Of course.
So we could really just sit down and have a tabletop on what should be, what didn't happen, and what could possibly happen. Not possibly, but more than likely happen in the future.
Well, maybe it's time for a hot wash in the middle of this response.
Well, I think that's why they didn't do a hot wash, because there's a saying, when you point a finger, 3 points back at you, but in this case, both fingers would be pointing at them.
Right.
And so they can't hot wash this because they wouldn't have any answers. Because we would hit them like boom, 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 boom.
Right.
We have facts.
Yeah.
We're not coming with nonsense. We have facts of what you failed to do and continually fail to do.
Yeah.
And you keep gaslighting. It's like, our eyes are wide open.
That's right.
And we're living in the midst of what you're saying that you're doing. And we can consistently say it's not happening here.
Right.
So
we're still positive people, even amidst all this. Angel, if there are 2 or 3 things that you think we need to focus on immediately to move towards solution, what would they be?
So I think first is you have to make neighborhood level data publicly available and accessible. And it's got to be meaningful data. So in order for it to be meaningful, there needs to be a dialogue and a consistent, dependable, reliable engagement with nodes, local community nodes, like groups like the East Harlem East Harlem COAD. And of course, the Harlem Emergency Network, right? So we are deeply embedded in these neighborhoods. We can tell you what we need in terms of information to guide the strategy to be responsive and be prepared. I think this avoiding decentralization of response activities, that's a distraction, and literally it's killing people. I mean, people's lives are at risk because they're wasting time trying to figure out who's doing what and when they're doing it. And so that political football has to be stopped. So that's the second thing. And I think more importantly is I think really maintain and sustain like bi-directional feedback loop. You have to course correct in a crisis. There isn't one way. You have to course correct. And sometimes things happen like you don't anticipate, like, wow, we didn't even think about, this particular thing being a barrier or et cetera. I mean, for example, it was Carol and another colleague of ours was like, wait a minute, sharing space and staying safe, that's a luxury to be able to stay safe while you're sharing space. Where's the guidance on that? And, we created the guidance under Carol's, why? Because Carol and others were like, hold up, wait a minute.
Right.
Has anyone understood how people live in this neighborhood? And the social characteristics and conditions of which people are living in these spaces? So, these feedback loops, if you put them in place, it allows for course correction in a much more immediate way. And that's missing that's missing.
So yeah, to put it plainly, feedback loops only work if both sides are listening. And one
Right.
of the problems we've had with these city agencies that we interact with is that we don't see them listening to what we're saying, because we've been saying a lot of the same stuff, not only during the pandemic, but for years beforehand. And our voices are getting hoarse. We're tired of talking about it. And we need that to happen right away. We need there's a lot of knowledge and experience that we have within our communities, and it's not being taken advantage of and respected by our city agencies, and they're the ones who are stumbling, and we're doing their jobs for them. I think that's the thing that ticks me off a lot.
That's it.
It's like, why are we figuring out how to do these communications when there are people who are collecting paychecks at various places, including Cadman Plaza and various locations throughout the city, whose jobs it is to communicate this information, and we're doing those jobs for them. And well, we're not doing them for them, we're doing them for ourselves. But if our taxes are paying for these people to do these jobs, we would at least want partnership,
Yeah.
and we're not getting the type of partnership that we need or deserve as residents of this city.
I just want to add that on top of that, there are, and I know we in East Harlem have had these positive relationships with representatives from various agencies. There are staff in these agencies that either come from these communities that we were working in East Harlem, are a voice for exactly these issues and aren't even being heard inside the agency, or being stifled or being oppressed or being shut down in some way. And so, and they can't even, advocate on behalf of neighborhoods like ours because of the bureaucracy and it having to, of all of the shit that the bureaucracy comes with. And so, so I just want to be clear that we are also talking about individuals in these city agencies who have positional power over practices and policies and structures, and they are creating it in a way that doesn't allow full transparency and engagement at the local level. And that's the problem.
Yeah. The saddest part about it is that we sat in a meeting, Angela and I sat in a meeting the other day, and someone asked me, what do I think the best practice for getting information out would be? How can we do that? That just frustrated me even more, because we've been in these meetings for 8 months saying, give us information. Let us know where we can find information. Get it to us. We'll get it out to the community. And they're still at the same place.
Yeah.
There's money that is available, resources that's available. There's always areas that's already sanctioned to get those things. And they're not going to come to people like us. Even things like with the air conditioners, how you say you have 77,000 air conditioners, but you say immediately 25,000 of them are going to go to Brooklyn. Why weren't they split up amongst the 5 boroughs? Those are the things. They get a lump sum of money, and there's a certain amount that's always going to be designated to the people who need it the least. And then we have to scramble for whatever is left. That becomes more and more unacceptable. And those people sitting in those positions, see, it's interesting because we are at the local level and we are volunteers. And so I think it's because the money doesn't sway us. We have the heart to want to do what we do. And that's all the more reason why we should be used to the fullest extent. Because we know where the needs are. We know who the people are who need. We know what we need, what we're lacking. But they're not going to come to us because they're too busy giving them this politicized agenda. You have to deal with this. You have to work it this way. This person is telling you how things has to go. And they're not even in the position to be able to help us.
Right.
You know, I mean, we know a lot of the colleagues was moved all over the place. I'm like, so what were you doing? I don't even know. 3
Right.
months was someplace.
Yep.
We sent you someplace for 3 months, which is not under your job title. And then you come back and say, I don't know. I did everything that I wasn't trained to do. And that's the problem.
Mm-hmm.
The main problem. People just, it's like, okay, it's not working. Rather than sit down and say, okay, listen, this is not working. Let's put together a solid plan. Let's bring in the people that can help us design something that will work. And then we can put it into action.
Right.
You know, as long as we're on the inside, when we talked about people living together, it took us what, 7 minutes to put that plan together? I mean, 7 minutes.
Mm-hmm.
You know, because we know how people live. And to see a lot of the things that we're talking about 3 weeks, 4 months later, here it pops up in somebody's newsletter. And we've already put it out. We put our heads together and said, listen, what do you do? How are we going to do it? X, Y, Z. We put it out maybe 3, 4 weeks later. Here it pops up. Somebody pops up like it's their idea. So if you see it because you're watching, so if you see these things, that's more of the reason why you should utilize us.
Yep.
To get your work done, make your job easier. But we're not going to do all of the work. You know, because if that's the case, we need to get a piece of the financial pies too.
That's right.
Well, Angel, I want to thank you for spending some time with us and sharing your perspective. I want to wish you and your family a happy Thanksgiving. Carol, wish you a happy Thanksgiving as well.
Thank you.
And we'll just continue to do the work. And I also issue I guess a warning to our elected officials and agencies. You know, we've been right since the beginning of this stuff. We told people weeks ago that the schools were going to close. And so people who've been listening to our broadcast have been seeing. And unfortunately, you know, we call it as we see it. We don't want to be the naysayers and negative information, but we continue to look at the data, we look at the trends, and we look at what's actually happening, and it's not working. And so it's unacceptable to have our local government not working more efficiently and more effectively on behalf of our communities. And it's just not, we're not going to accept it. We're not going to go into 2021 with, you know, unworkable situations. And so agencies, elected officials, they need to work out things. They need to work out their differences amongst themselves. And they need to find a way to work more effectively to get the job done, because lives are on the line and we don't have time for the nonsense. So
Absolutely.
Absolutely.
And on that note, we'll say happy Thanksgiving.
Thank you. Have a wonderful, wonderful holiday, both of you. Stay safe.
Yes.
Again, before we leave, let's make sure we put that issue out about those gatherings.
Yes. Yeah, keep it close to home, keep it low key. That's the best thing. Use social media if you need to. Protect the people who need to be protected, and that includes you.
That's right.
That's right.
Yep.
Just because the city is saying no larger than groups larger than 10, if you live in a 2x4 apartment, you should not have 10 people in your house.
Yeah.
Look at the size of your space.
Mm-hmm.
And watch. I know people are still taking temperatures at the door, but when people, if whoever comes in there, you need to have your little bottle of water and bleach, wiping off those handles in your sinks, your toilets, you know, the touched areas, frequently touched areas, if people are going to be in your house. And do not allow people to upset you, stop speaking to you, get angry with you if you don't show up. Because the fact is, you want to stay home to protect them, and you want to stay alive to see them next Thanksgiving.
Yeah. And you can time shift too. You don't have to see everybody on Thursday. You can see them on Friday or Saturday or Sunday. Do it at a time when everybody's not traveling, so you're not exposed, especially if you have to travel on public transportation to get to a Thanksgiving event. Just don't do it.
Right.
Do it on Sunday. Do it next week. Have Thanksgiving a week later. There's no there's no reason why you can't be thankful on another day.
That's right.
Right.
Be thankful on a day that you don't have to travel with everybody else in the world, when the likelihood of spread is much higher on a day like that.
That's
So
right.
protect yourself, take care of yourself, and let's take care of each other.
And let's not forget Zoom.
Yep.
You can
There it
have a Zoom giving.
Yep. Yep.
Thank you all so much. Thank you.
Okay.
And,
Of course. Thank you. Thank you
Yep.
both.
Okay.